Good afternoon and welcome to Muskegon Rotary. My name is Tim Arter and I have the pleasure of serving as your president this year. Today's program will be a presentation explaining the federally funded State Health Insurance Assistance Program. We will begin with the Pledge of Allegiance, followed by a reflection from Adam Bell. We will also recite the four-way test at the end of the meeting. So at this time, let's say the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. At this time, we'd like to have a moment of silence. Jeff Fortenbacher's mother passed away, and I think she's having a service. They're having a service for her today. So, if we could take a few moments of silence. Thank you. Adam?
Good afternoon. It's good to be here. It's good to be back. I had some plumbing issues, a new hot water heater, and I've been gone for a couple of weeks, but I'm happy to be back. I'm turning 65 on Sunday. At least I think I am. It may be Saturday. I don't know. When I was 35 and my mother was dying of cancer, I moved back home to take care of her, and we had a lot of great conversations. We had some issues over the years, but we put a lot of them to bed during that year when she was sick. And right before my birthday that year, she said to me, "Happy birthday," on the 21st of September. And I said, "Mom, it's tomorrow. My birthday's the 22nd. And she looked at me and she said, "Did I not ever tell you that story?" And I said, "No." And she said, "Well, actually, you were born on the 21st. The hospital made a mistake, and when I pointed it out, they said it would be too much trouble to change, and so we just left it as the 22nd. And I said, "Mom, I'm going to be 35. It's a little late in life. If there's one thing that one counts on, the one constant in one's life, the one thing that you know will never, ever, ever change, it's your birthday." Little did I know that this uncertainty would become a metaphor for most of the rest of my adult life. But as I approach my 65th birthday, I have been reflecting on busyness, because this is a time where I should be looking at retirement, and I find in my life I'm as busy, if not busier, than I've ever been. And then I look at the newspaper, and we have an election, and all of these busy things, and all of these things to decide, and every Facebook post and social media post that I think I absolutely must respond to, or the world will not make it to tomorrow. I feel this overwhelming need for what I had in my childhood, and I think most of you did too, unstructured time. So my reflection for all of you for today is unstructured time. Take a moment in this busy season, no matter how busy you are, no matter how stressful the election becomes or the world news and all the serious, truly serious things that are going on, take a moment to sit in the garden or read a poem. That's my happy place, and my reflection today is a very simple poem by Robert Frost. It's called "Acquainted with the Night," and this is what speaks to me. I have been one acquainted with the night. I have walked out in rain and back in rain. I have outwalked the furthest city light. I have looked down the saddest city lane. I have passed the watchman on his beat and dropped my eyes, unwilling to explain. I have stood still and stopped the sound of feet when far away an interrupted cry came over houses from another street, but not to call me back or say goodbye. And further still, at an unearthly height, one luminary clock against the sky. It proclaimed the time was neither wrong nor right. I have been one acquainted with the night. Take time for yourself.
Thank you, Adam. At this time, please enjoy your lunch, and we'll be reconvening in a few minutes. Thank you, everyone. At this time, would Rotarians with guests and visiting Rotarians please come forward?
How are you doing? Ladies and gentlemen, every once in a while, I get to meet a rock star. You're looking at Ava Bentley, served 2 years at Mona Shores as the president of their Interact Club, went to U of M, excelled in the Rotaract program at U of M, graduated in May with a biomedical tech, cognition, and neuroscience degree. Yeah, and now she's working at the University of Utah Hospital in the cardiology department, and she's going to be in Rotary someday. I just got to believe. Ava Bentley.
Melissa Moore with Reed Muskegon, and my guest today is Nicole Applewhite, and I'm trying to get her title correct, but she is the program director for the Center, or something like that, for the Center, I'm giving her a promotion, for the Center of Health and Wellness for the Urban League, so based in Grand Rapids. She reached out to me at Reed Muskegon because they have a grant to work on smoking and vaping cessation and prevention with our youth. And she is trying to reach out to organizations, churches, schools in Muskegon County to try to bring that education into our county. Was having a little bit of difficulty getting people to respond to her, so I thought Rotary would be a good place to bring her to make that connection. She may have to leave a little early because she is leaving to head back to a conference in Grand Rapids, but she gave me a stack of her business cards. So please feel free to come to me afterwards or email me and I will connect you to her directly.
Yeah, go in the middle mark. Well, good afternoon. I am very proud to introduce my neighbor, Ellinger Salgado, and he is my neighbor next door to my business. I was going to say, like a good neighbor, but this is farmer's insurance. Okay, so, all right. But it was appropriate, and he's been great. I had an opportunity to meet this young man. I keep telling him, I said, you got to go to Rotary, you got to be, network. You got to network with Rotary and also meet some of the people that are here. And so I introduced him and I said, well, let's pick time, and today is about Michigan insurance, so I thought that's good. Real quick, Ellinger from Russellville, Alabama. He does not have an accent, but it comes of a family of 8, moved to Hart, Michigan in 2014, 3 brothers and 3 sisters, married, and congratulations, he has a 4-month-old son. Started the industry when he was 19 years old, and just an amazing young man. Opened up his own farmer's insurance agency 3 years later at the age of 22. The agency is bilingual, English and Spanish. The only thing I know is dos cervezas por favor means 2 beers. That's he does everything from auto life insurance, small business insurance, and being bilingual, obviously seeing people from all around the state to bring business here to Muskegon County. So welcome, Ellinger. So.
Good afternoon, Rotary. Marty Seitzma here with some guests that are students, as you might expect, and I've had 2 bad pictures of me last couple of weeks. It wasn't you, it was that other guy. All right, enough about me. We've got North Muskegon Norsemen in the house. To introduce 2 of the students is Jen Schultz. She is the principal at the high school.
Thank you. I was actually at a conference yesterday in Chicago, and one of the things the presenter was saying was that students aren't apathetic, they're just uninvited. So I wanted to say thank you to all of you for inviting us to be there and for empowering students like this to be able to get out in the community. North Muskegon, we have a huge population of students who serve, and these two I chose because they really excel in that area. I'm going to let them shout themselves out and talk about all the great things that they do, but we have Bear Brewer and Sophia Corbin. So here's Bear.
Hello, I'm Bear. I am a sophomore at North Muskegon. I play the cello. I'm also involved in Interact. Me and Sophie actually are on the Early Act committee, so for a really long time, because of COVID, we didn't have an Early Act at our school for elementary, and we're both working on bringing it back together. So, I also teach cello lessons and student teach like for elementary orchestra, and that's kind of all I have to say about me. So.
Hi, I'm Sophia Corbin. Like Bear was saying, I'm at North Muskegon. I'm a junior, and I am class president. I am on Environmental Club. I'm starting Interact this year, and I'm on the Early Act subcommittee. I'm also president of our French club and historian of Orchestra Council. I play the violin, and I am in the Premier Strings West Michigan Youth Symphony Premier Strings thing. And yeah, my mom's the director of that, so started when I was little. And yeah, I have a sister at U of M, and I would love to go to U of M, maybe study political science or something like that. Yeah.
At this time, I'd like to call upon Rem Sprague to introduce today's speakers.
Thank you, Tim. As Tim said, I'm Rem Sprague. Good afternoon. I'm pleased to introduce our program and our presenters this afternoon. Today we will learn about an innovative program funded by the National Institutes of Health, putting Muskegon on the national map. It's a 10-year grant that you're going to hear about. It's actually managed by Access Health, and our presenters from Access Health today are Samantha Cornett and Allison Ravel. Please come up, the two of you. Samantha is an attorney, actually, but she joined Access Health about 10 years ago, and she is the Director of Community-Based Services for Access Health. Excuse me. In this role, she works closely with partners in healthcare delivery, grassroots organizations, community leaders, and local coalitions to improve our community's health. Allison joined Access Health last December, and she is the project manager for Sustainable Health Investment Partnership, the NIH program that we will hear about this afternoon.
Thank you, Rem, for that great introduction. And it's wonderful to be here today among a room of such wonderful people championing work in Muskegon. So I'll start the slides now. Great. So again, as Rem shared, we're here to share from Access Health to share a little bit about the Muskegon SHIP, and that is that Sustainable Health Investment Partnership. I'll tell you a little spoiler, it's not a boat, right? Although we like boats. And it's not, when we think of investment, it's not necessarily financial investment. It's really, we're looking at investing expertise, investing time, investing collaboration, all of the things that we do so well here in Muskegon as a community. It is, as Rem shared, a landmark program for the National Institutes of Health. This is the first time that they have partnered with community to have community lead health improvement. It's very rare that they've never made an award like that to community programs. They also don't typically make 10-year awards, and this is a 10-year program. We just came back from the annual meeting, and to say that they are excited is an understatement. They are really, really supportive and championing this work. The fact that it's here in Muskegon, Access Health was asked to apply, and thrilled to have gotten to this place and to have this investment and this validation in Muskegon. But when we look at what we're validating the work that we've all collectively done here in Muskegon, and the potential that we have to continue to move the needle forward. So, Rem introduced us, you know who we are. Thank you. So, Access Health is, you all know Jeff. Access Health has been here for 25 years, right? Next month, we're celebrating our 25th anniversary as a change agent to build pathways to improve health in Muskegon County. We will be, as we celebrate our 25th anniversary, we'll be sharing some of that impact that we've had among the past 25 years. I think it would be bad form for me to spoil it now, but there's some pretty exciting impact that we have to share. So if you're familiar with Access Health, what you're probably most familiar with is that health coverage model. That's both our legacy program and still our anchor program as an organization. And it was created by the community, by coming together and thinking through what would be most meaningful to serve Muskegon and the needs specific to Muskegon to improve health. And what that group created is our health coverage program, which was created to support businesses, local businesses, and their workers to navigate those barriers, often cost barriers to improved health, but also recognizing that close connection. A lot of the things that get in the way of good health are the same things that can get in the way of workforce stability and financial stability. So looking at that holistically and saying, how do we partner together? So the coverage model is health coverage, and it's some pretty incredible, robust health coverage that's incredibly affordable. But integrated within it is relationship-based health coaching to support folks in navigating not only health as it exists within the clinical space, within your doctor's office, but also all of those things in the world that you navigate every day that impact your health. We call them social determinants of health, but the reality we know it's life, right? It's all of the things. Close connection with our business partners, some of which I see in the room here today. You guys are awesome. Thank you. In supporting their ability to both attract and retain workers. And the worker force that we serve is folks who make too much to qualify for Medicaid, but not enough to afford true access to coverage. That used to look like high premiums, right? Back when we started in 1999. Sometimes that's still the case. More often than not, what it looks like is high deductibles. So we're looking to be that bridge to support folks as they are no longer eligible for Medicaid and support them in making that climb until they can afford traditional health coverage. So it's not meant to be the forever solution. It's meant to be a supportive path to continued growth and mobility. I clicked the wrong button. So when we think about Access Health and the coverage plan, it's Coverage Plus, right? It's Coverage Plus, that relationship-based health coaching that supports folks not only in acute crisis, which is critical, right? But also towards setting goals and working towards improvement and stability. A lot of times resources are only available when you need them the most, right? Which is good. We need those resources. But we also need resources as we continue to make those changes and to navigate those barriers towards growth and empowerment. In addition to that, Access Health is an economic mobility tool, really working to help small businesses in our community attract and retain employees, and that transitional bridge that directly addresses those related barriers. Let's see if I can get the right button now. Yes, okay. So the coverage plan was, again, created by community to meet the needs of community. It looks, in many ways, very similar to what it did in 1999, which is pretty incredible, the foresight that has when you bring folks together to think about what the ideal state would look like. zero deductible. We are entering 25 years of never having a deductible. Intentional design to build access to improved health, right? $10 copays. I think one of the most poignant facts is if you are an Access Health member and you're admitted to the hospital, your maximum cost sharing is $300. It doesn't matter how long you're in. We've been evaluated by both the federal government and a state-funded actuarial analysis, both of which confirmed that this coverage aligns with the goals of the ACA and is robust coverage that is certified as such. We were the first plan in the nation to receive that certification right here in Muskegon. The state also conducted an actuarial analysis that demonstrated the incredible robustness and strong coverage of the plan. They call it metal tiering, so there's bronze, silver, gold, platinum. We're gold right at the cusp of platinum. Looking at that removing the cost barriers, that deductible, again, $0. You'll hear that from us all the time because we don't believe that this should be a barrier. The monthly cost is $82 a month. And you can see the comparison to traditional coverage, right? Recognizing that this is a transitional path to a space where you can afford traditional coverage. And again, it's rooted in that addressing the wholeness of health, or what we would call the domains of health. So you'll see on this chart, when I said it's life, it really is. That physical health, social health, emotional, spiritual, educational, and really seeing that that is all interconnected. And what's been demonstrated over the past 25 years here in Muskegon is that when you provide support in navigating those things, you ultimately improve the health of folks and you're able to keep costs down, right? The costs aren't low because we say, guess what, you can't go to that appointment, right? The costs are low because we stand side by side with our members and work towards improved health. So a little bit about the NIH Compass opportunity. That's how we came into this space and was the rationale for asking Access Health to apply. It is, again, a landmark award of community-led research. We have research partners in this, right? This has an evaluation component from the get-go and also an incredible amount of data that will be available to our community as we help to build out the ship. Looking at those structural factors, those things that aren't, you just need to change your mind on something, but those policy barriers or systemic barriers that people run into that no individual can change alone, but empowering us as a community to come together and make that change. It is, I clicked too fast. They're supporting communities in building sustainable solutions. One thing that's been shared that's really exciting is they see the opportunity to replicate these models in communities across the nation. So there's the potential for Muskegon to build something that could support not only Muskegon, but perhaps help folks outside of the community. I'll hand it off to Allison. I'll get the right button, I didn't.
Thank you, everyone, for having us here again. So I'm going to talk a little bit about how we came about with the NIH grant opportunity and where we're at now with it. So over the course of 2023, hundreds of community organizations applied to be a part of this program. And in September of 2023, 25 locations were announced. And we are one of those locations. We're honored to be. You can see from the map that they are geographically diverse in terms of the locations of where the different projects are. They will serve a variety of different priority populations, and some of the topics that are addressed by the different locations include economic development, quality care, and healthcare access, among other topics. So all of these different community organizations are working with their research partners to implement structural programs within their communities and then evaluate and assess the outcomes associated with those programs. So you see here an outline of our 10-year timeline. We are currently completing year 1 and approaching into year 2. These first 2 years are intended for planning and the construct of the ship. Activities that we've done during these first year and will continue into year 2 include our convening our think tank Health Equity Research Assembly, which consists of a wide variety of local stakeholders helping to guide the way we proceed with this project, as well as identifying community needs and capacities, and we are currently in the midst of completing a comprehensive community needs assessment. Years 3 through 8 will include the onboarding and enrollment of people into the program and servicing them and providing them what we're going to be doing within the SHIP, which we'll talk about in a little bit. And then years 9 and 10 are meant to evaluate and measure the outcomes of this program. Which leads us to our task of designing this community-led structural program. I'm going to lower this just a little. So the problem we've identified is that Muskegon has traditionally had some poor health outcomes. And as recently as 2023, the County Health Rankings and Roadmaps Association ranked Muskegon County as number 69 out of 83 counties in Michigan. So what we're looking to address, again, is the poor health and health disparities. And health disparities have been defined as a particular type of health difference that is associated with economic, environmental, and social disadvantages. And although Muskegon offers numerous resources and assets within our community, poor health outcomes compared with the rest of the state indicate remaining one of the least healthy counties in Michigan. The indicators listed here convey that both health outcomes and health behaviors, both in physical and mental health capacities, are a priority and have room for improvement. So that leads us to the question, well, why does Muskegon have some poor health outcomes? And there's been many years, almost a decade now, of study within Muskegon County of the ALICE population and trying to understand the barriers and things that they encounter that make living paycheck to paycheck, one emergency, away from a financial situation, negative situation, why that continues to be the case in Muskegon and how it might affect people's health statuses. So the impact that economic stress and health has on one another has been well established, and these things can lead to high medical cost interventions, which then create more financial stress and instability. We have spoken with the community over the years through different measures and capacities, and they have emphasized that economic and employment-related barriers are contributors to unsatisfactory health status. So some of you may be familiar with our livability labs. Those have been occurring since 2019, and we are now entering our 5th installment of the livability lab. And over the years, incredible amounts of compelling community input has been gathered and evaluated. And featured here are just a few of the sentiments that have been voiced by members of our community over the years through our livability labs. Residents have shared time and time again that certain barriers have negative impacts on their quality of life. This input is being taken into account as we build the SHIP. So we're going to talk now about what we're proposing to do within the SHIP and how we plan to do it. Access Health Sustainable Health Investment Partnership seeks to build a path to economic mobility for Muskegon County residents through program and resource alignment, mitigation of barriers, and collaboration that supports a transitional direction out of poverty.
Okay, so what is the SHIP, right? Through the application, we needed to propose the bones of the SHIP. But the SHIP itself is, as the community, it's ours to build, right? So we have the bones. I'm going to talk about the framework, but we're looking forward to these next 9 years of continuing to build it with many folks in this room. I see some of you who are already a part of that. Thank you. The door is open. We'd love more of you at the table as you're interested and able. The SHIP will be a community wellness plan that's designed to improve that health by addressing those shared barriers. Again, community designed. Initial core focus, you'll see, is on aligning access to healthcare, childcare, and transportation within that relationship-based health coaching model with research-informed design and evaluation. I'll never get that right button. Okay, the research team. All NIH projects require a primary investigator. In this instance, I serve that role. Was supported strongly by Jennifer Berengen, who is a data specialist, and Dr. Byron Vernardo, who provides guidance on health impact. Allison is our fearless project manager. We couldn't do a piece of this without her. The think tank is that space where community partners come. So if you're interested, say the word. We have a seat at that table for you. Our community intervention partners, none of this is us alone, right? This is a community project and a community opportunity. And then our research partners, the Michigan Public Institute of Health in Lansing, and then supporting that economic look, the Upjohn Institute out of Kalamazoo. So we're looking to see how all of these pieces, all of these things that we know impact the puzzle and the barrier, how they fit together and how we can address them. When we look at what the ship actually is, it might not be a ship, it might be a bridge, right? But we're looking at strengthening that benefits Cliff Bridge by aligning existing programs in our community and then looking to see where those gaps are and very intentionally working to provide solutions. Not duplicating, right? Never duplicating. Looking at what we have existing and then looking at if additional resources are needed. Particular focus on those green areas, which are the areas where folks are either at risk of falling off the bridge or a cliff, or they've already climbed it and they've at risk of falling back down. The benefits cliff, if you're not familiar, is the space where if you make more money, if you get a raise or get more hours at work, you may lose more benefits than what you gain. So you're financially, literally trapped in, you cannot achieve economic mobility. What's in the ship? It's that personalized health coaching supported by resource navigation, and augmented with some financial literacy services. One thing that is, and there's more, so I'm flying past this to get to the next slide, but I think an important thing to realize is that businesses, HR if you have one, but small businesses, anybody in the business, can refer workers into the ship. So when there's workers that are facing these barriers, there will be a solution. There will be a path for them, and there will be some support for both the workers and the employers. Again, aligning and coordinating local supports. This is what we see the first implementation phase is focusing on. Anchor supports that are really seen as innovative. We know locally they're innovative. I got to tell you, across the state they're seen as innovative, and on the national platform they're really excited. Access Health, we talked about that. You know about that. TriShow Childcare, I'm sure many of you are familiar with, an incredible program that was piloted here in Muskegon and now is statewide. Wheels to Work is similar, where it's that multi-share, partners coming together for rides to work. We recognize and see more and more that that might not be the sole transportation solution in Muskegon. We have a committee actively working on that. Open to questions. Thank you.
We have time for a couple of questions.
Yeah, so this is highly relevant to Rotary. We were engaged in health improvement a few years ago with our 1 by 21 initiative. And it just a comment, it demonstrates how complicated health is. It's not about getting access to doctors. It's not just about telling people to quit smoking and eat less and get more exercise. There are reasons why people make the life choices they do, and that root cause is something you're going to be exploring with this, and all of us need to be aware that this is not a behavioral issue, this is really an environmental issue, and I'm so pleased and proud of Muskegon to achieve this award and this recognition.
say, I would just, thank you, Rem, and I would echo that it truly is Muskegon's award.
Thank you to your both. Great presentation. I'm wondering if you couldn't give maybe a brief example of a family situation where you've helped somebody to kind of bring it home to everybody about what exactly happens.
So do you mean within the SHIP or within
Yeah.
Access Health?
Well, either
Because-
one, what this program will do for families in the community.
So the SHIP we're still building, right? So there's nobody enrolled in it yet. That will happen, Allison, you're the keeper of all dates, but in about a year.
Yeah, September 2025.
Okay, I don't know if we could. How it's envisioned is it's sort of a no wrong door approach, right? If you have a family that is navigating, so let's say, I'll use myself as an example, right? I was a single mom for many years, and a lot of times trying to find work where I could afford childcare, and sometimes literally how to navigate the transportation, or my car was no longer working, and I needed transportation support to keep my job. That I would be able to engage within the SHIP, have somebody support me in navigating that, right? Stand alongside of me and figure out, how do I navigate this? What are the steps? What are the resources? But then provide that support in figuring out those next steps, right? I went from there to ultimately to law school and hear this, and I gotta tell you, I learned a lot of things the really hard way, right? This isn't all about me, but it's just in not sharing any patient information, it's easier to do that.
Having been a part of Access Health through the Muskegon Health Project for 25 years ago, I am passionately concerned about the drug and alcohol addiction in this community. And I see you have drinking addressed. I'm not seeing anything about the services for drug addiction and detox. Is that something you're undertaking?
So that's a great question, and I want to clarify that slide. That was some of the data points, and when you look at that community health rankings, which, as many of you may know, actually no longer rank communities, which might be a very good thing. But those were some of the areas where we saw the highest disparities, right, based on the data. But as far as services and priorities within the SHIP, I champion that. I agree. These are the things that we want to come together as a community to prioritize. So not evading the answer, but I think it's not solely ours to set. We're really looking to support community in doing that, but we'll definitely bring that forward. And if you're interested in joining the think tank, see us. We've got a card.
Well, thank you very much for your very informative presentation. I wanted to let you know that Rotary will be making a contribution to the Shelter Box, which is a partnership that, in your name, go ahead. And so we're going to be making that contribution to Shelter Box, which is a partnership between a global entity in serving people that are need shelter during disaster. And so thank you very much. Okay, I'm getting oriented here where the screens are. So we have the birthday slide, and we have birthdays this coming week for Todd Rexford on the 19th, Nick Morano the 20th, Adam Bell, as he mentioned, the 22nd or the 21st, whichever you want. Stacy Gomez the 23rd, and John Noling the 24th. John. And so at this time, let's we have them in attendance. Let's sing happy birthday to them, if you would mind. Happy birthday to you. Happy birthday to you. Happy birthday, happy birthday. Well, thank you, and a reminder that if you have a birthday, especially during this period of time, please consider making a $10 birthday gift for the Caring Connection and the benefits. There are envelopes up here, or you could refer yourself to the RIM, which has a hyperlink to it, to a QR code. So please consider it, because we're using, for the Caring Connection, we're using it for our own members. At this time, we have a spotlight video under our Rotarians in Action series that we have. Today we're spotlighting a relatively new committee, Peace Builders, which is actively engaged with our club, our community, and our youth programs.
I'm Kathy Brubaker Clark. I am here today. I'm co-chair of the Rotary Peace Builder Committee. I'm announcing today, since this will be shown at Rotary on September 19th, again, International Peace Day is the 21st, but we don't meet on the 21st, so that's why this is being shown today, that in recognition of International Peace Day 2024, we're seeking young people's perspective on peace. And we want to see how they, in various ways, express how they view peace, how they feel about peace, how important peace is to them. So we're going out to our Interact clubs that already started actually at the end of last year's school year. And I will say Doug Wood and John Noling have been instrumental in this, working with the kids, getting them excited about it, the students. And the question we're asking is, what is our vision of what peace in the world should be, and how do we best get there? And we're asking the interactors then to present back to our Rotary Club on December 5th in whatever venue they choose, whether it's the spoken word, music, art. We're leaving it up to the kids to decide just how they might want to show that. So we're looking forward to that program on December 5th, where we'll get to see the youth in action and see their hopes and dreams for the future as it pertains to a peaceful world. So I leave us with a question from the Rotary Action Group for Peace website. What if we started thinking about Rotary as more than a collection of service clubs and started thinking of ourselves as a global peace-building force? And I think that's possible. Rotarians have and can continue to change the world in a positive, peaceful way.
At this time, we have some announcements. Is that there's no rewind there is a rewind meeting tonight at Unruly at 5:15. And then I'm going to have Irma come forward with just a brief but important message.
You guys are always tired of seeing my face, aren't you? Yay! Unfortunately, there will not be a Sunday Fun Day event out at the Luge on Sunday due to unforeseen circumstances, but stay tuned. The Social Events Committee will put some other things out. Was that quick enough for you?
That's quick. Thank you very much, Irma. A few other items here. The district conference, we've been talking about the district conference quite a bit. Again, it's on October 18th, 19th, and 20th here in Muskegon. The Board of Directors approved a provision to help some folks to register. The club is offering a $100 register incentive to the first 10 members who have never attended a district conference. So we have a couple of people that are accepting, but we have up to 10 members. If you are interested and have never attended a district conference, please contact Christy Nagengast or myself, and we can help you through the process. But we're really trying to encourage Muskegon participation. District Governor Brianna Scott is leading this effort, and we want to support her in that effort. So you can register. Use the just this last week or earlier this week, Kim Borsma sent out an email blast which provided a link to register. There's also a link in the RIM. Or if you wish to go to the District 6290 website, there are registration for the 3 events available. If you decide to sign up for all three of the events, you get a discount. Just a quick reminder that Harvest Fest is coming up. They're really need your help in a couple of different ways. One's sponsorships, and start buying tickets. Muskegon is known for buying tickets at the last minute, and they are certainly showing their wares this time around. So please, it's so easy to sign up. Please do it. For anybody who's been in the ticket selling business, it's a little scary when it's a little scary at this time, so please help them out. And if you're planning on going, which is going to be a great event, please help them out by buying some tickets. We have a new member Coffee Connect tomorrow morning at 8 o'clock. So if you want an eye opener, they're serving coffee at the Lakeshore Museum again 8 o'clock. Rewind's Highway pickup is going to be on Saturday, September the 28th. Arrive probably with your coffee 8:45 on the 28th of September, and I've been assured that you will finish no later than 11 in the morning. Rewind has commenced its planning for the chili cook-off. I know it's a long ways off there. It's going to be in February, but they're working hard on this. They could really use some help. They are looking for committee members from this group as well as theirs to assist in the event planning, promotion, ticket sales, sponsor support, and other roles. If you have any interest, please contact Jerry Kuster, Katie Drake, or Craig Parada. I saw him earlier today. Contact them, and they'd love to have some support. Muskegon Rising, episode number 37, the Culinary Institute of Michigan. That's the topic. Join Rem Sprague and Aaron Mikey as they explore the SIM at Baker College of Muskegon, one of our treasures we have in this community. So seek that out. This time we will turn it over to the raffle. There we go. Frank.
We're just going to change it up a little bit today. Thanks to Jason Pizecki, James Scott, the first winner is only going to get $3 a quarter. It might not be a winner. 693.
693. Yeah.
Now we'll do that $10.
Jim, you're going to be able to stuff some parking meter somewhere.
$596. Almost gave another quarter. All right. 561.
561. 561. Thank you very much, Frank. Whoa, we got an active crowd here. They must be waiting for the announcement of next week's program. It will be the 5 Rotarians will be taking 5 minutes each to share what their committees are working on. So 5 Rotarians for 5 minutes each. And then at this time, let's please rise to recite the 4-way test. Of the things we think, say, or do, is the truth, is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? Thank you very much for your attendance and participation. See you next week.